Hi everyone and welcome to another Therapy Tuesdays. Today we are bringing awareness to World Down Syndrome Day, so if you're interested, please stay tuned. So first of all, let's discuss what Down syndrome is. It is also referred to as trisomy 21 because it's a genetic disorder that's associated with having a third copy of chromosome 21. So normally most persons will have 46 chromosomes. People with Down syndrome have 47 chromosomes. Having extra or abnormal chromosomes changes the way the brain and body develops. Down syndrome is typically associated with having physical growth delays, characteristical facial features, as well as mild to moderate intellectual disabilities. The average IQ of a young adult with Down syndrome is about 50, which is similar to an 8 to 9-year-old child. However, this can vary widely. The presence of an extra chromosome occurs by chance, so let's discuss some of the factors that can cause an increase in this chance occurring. There's the age factor, so the older you are when you get pregnant. So most doctors consider 35 years and older running a higher risk of having a child with Down syndrome. So if you have a brother or sister with Down syndrome, or you had another baby with Down syndrome, this can also increase your chances. So let's discuss some of the characteristics of children with Down syndrome. Firstly, let's talk about their distinctive facial features, such as the possibility of having a flat face, small chin, small ears, slanted eyes, poor muscle tone, flat nasal bridge, as well as the possibility of having a large protruding tongue due to having a small mouth. Other common features include having a short neck and excessive joint flexibility. Most children with Down syndrome are also born with heart, intestine, air, and breathing problems. Let's discuss their intellectual capacity. Most individuals have a mild intellectual disability, which is an IQ of about 50 to 69, and some have a moderate intellectual disability, which is about an IQ of 35 to 50, and then there are the severe cases that have 25 to 35 IQ. Persons with Down syndrome have better language understanding than an ability to speak, so some of them usually have a stutter or rapid and irregular speech. They function fairly well with social skills, and behavioral problems are not generally associated with Down syndrome. They experience a wide range of emotions. They are generally happy, however, symptoms of depression and anxiety may develop as they get into adulthood. They have so much love to give and they are so expressive in their emotions, so they bring you into their world when they're sharing their joy and their happiness, and it's just so contagious. I've had the privilege of meeting some persons with Down syndrome, and they're such amazing human beings. They have so much talent, and they're so rich with their expression. And most of them don't allow their disability to define them. They don't look at it as a negative, they look at it as a positive. They embrace themselves and they embrace their individuality. Although they may have some limitations in health and intellectual capacity, they have many talents that they can do very well, such as arts and craft, as well as literary skills, musical talents, interest in fashion and cinematography, as well as other skills and functions. Something to note is that the first World Down Syndrome Day was held on the 21st of March 2006, and in 2011 the United Nations General Assembly recognized it. The 21st of March was chosen as a date, the 21st day being the chromosome number 21 and the third month representing the trisomy. On social media, you may see a lot of campaigning about wearing lots of socks or wearing odd socks on today's date. Let's discuss why. This is to bring awareness to Down syndrome and to show that people with Down syndrome are different, but they're still the same. Quote an article that I read, an odd pair of socks can be differently patterned, but can still be happily worn together if we change our attitude about having to wear matching socks. So maybe I'll see some of you out with your socks today, and remember, continue to bring positive awareness to World Down Syndrome Day because we are all equal in this world. Remember, each one, teach one. Let us be the change that we want to see in this world. Thank you for viewing Therapy Tuesdays and do have a lovely day. Also, if you have any questions or comments about today's topic, feel free to message me and I will get back to you as soon as I can. Take care.